Hello, Harvey Olivio at Carrington College, clinical instructor. I have the respiratory guy, Mr. Houston, doing the video.
Greetings, everyone.
We are going to do our competency for nasal tracheal suctioning. So, as always, check your orders. Make sure you have an order first before you attempt to do this. You cannot do NT suctioning without an order. Also, I want to make a little side note. If they ever order frequency, that is not a good order. You should not be suctioning a person every 2 hours or on a frequency. It should be as needed. Okay? Make sure you get all your equipment ready. I have my equipment here in the room. So I'm just going to go over a couple things with you. I have my manual resuscitator, so my ambu bag. I have a couple different size. Well, actually, these are both 14 French catheters, but two different packages just to show difference of two different kinds. I have my NPA, my nasal or pharyngeal airway, and then I have lubrication, must be water-based lubricant. This is another 14 French suction catheter, just a different style. And then I have sterile water, and then I also have my suction. So this is our portable suction unit. In the hospital, you will most likely be using one that's attached to the wall. We do have the vacuum input for it, but we do not have the actual suction canister with the regulator. So once you have all of your stuff assembled, we're going to check everything and put it together. So I'm going to go ahead and plug in my ambu bag. So this one I'm going to have ready at the patient's side. Okay, and then I'm going to, for demonstration purposes, I'm not going to turn on the compressor because it's really loud, but know that you would have this ready and running. So you would run this at 10 to 15 liters or flush, whatever is necessary for the patient. If the patient is on something already, like let's say a nasal cannula, you would switch that out and take it off so that we can do our suctioning. But because the patient is not on any oxygen, we're going to start just like this. So for the sterile technique on the gloves, I'm going to go ahead and take that out and show you. So you want to start with your sterile filled. So this is going to be sterile filled. Okay. So you're going to open this up like so. You have your right hand and your left hand. I am right-handed, so I'm going to try to do everything with my right hand and have my left hand as a dirty hand. So keeping this sterile by not touching the inside. And then once I do go in, I'm just going to take my thumb to try to get the end of this and then try to put my hand inside here to keep it clean. Okay, I'm not touching the inside yet. Okay, I'm going to use my other hand just to touch the outside. See why I'm trying to put this on, and you'll have different sizes too, so you typically want to use whatever size is appropriate for you. Don't use a size that's too small and doesn't fit you right. So I'm going to go ahead and put these on. Okay, I'm going to go ahead and grab this because it's giving me a hard time. And there we go. So I think I have it on backwards. Okay. But you get the idea, so I have it. This is going to be my clean hand, so I don't want to touch anything with my clean hand. Then I'm going to go ahead and get my basin ready. So this is my water basin. I'm going to have this for clearing my suction canister, so I would pour water into here. I'm not going to do it for real, but you would fill that with water. Okay. Then this is part of my kit. So this is clean for now. So I'm going to go ahead and grab this with my clean hand. Then I'm going to attach, without touching this to anything, my suction. And you'd want to have your suction -80 to 120. Different textbooks will say different numbers. Just make sure you follow whatever your Egan's textbooks say and know the proper setting for your suction. And then I'm going to go ahead and turn this on just to show you. Then I'm going to turn it off. So you can adjust your regulator and put it to whatever appropriate regulation that you need. Okay. Now that this is being held, I can touch this side, and that's my suction. Okay. So I am going to continue to hold this, but I'm going to wrap it so it's clean in my clean hand and not touching anything that's dirty. Okay. This is my dirty hand, but I'm going to pretend I have a normal glove on. Okay, we are going to put some lubrication on here. So I have water-based lubricant like so. I'm not going to open it, but I'm going to pretend that I put a bunch on there. And
And
then
you measured that that nasopharyngeal already, so you know that that's the correct size.
Right. So, but for demonstration, I'll go ahead and measure it again. Thank you, Mr. Houston, for reminding me. So from the earlobe to the nair. These come in different sizes, so if you do find a unique size, it's just not fitting appropriately, but you've measured, you can always go down to a smaller size. So we're going to go ahead and put this in. So if there's any resistance, don't force it. We're going to pre-oxygenate the patient. So we're going to go ahead and give him some oxygen. I'm going to pretend that I'm giving him some good breaths. I'm going to pretend that he's ventilating good, a little bit of pre-oxygenation there, and you're just manually assisting his breaths. You know, we're not breathing for him. We're just giving him some oxygen to help him out. Now that I'm ready, I'm going to unravel my suction catheter. You'll see there are numbers on here. You only want to go till you get resistance or meet a gag reflex. So if this patient had some secretions down and you just weren't able to get to him and he couldn't cough them out, you may do this NT suctioning and be able to get down to the lower airway with the suction catheter. So you're going to go ahead and insert this. This also protects the nose so that when you're doing this, you don't damage the airways. And then you're going to suction on the way out. So I would be holding this depressed and I would be pulling out. As I'm suctioning on the way out, whatever I get, I'm going to go ahead and take this and clean it so that I'm cleaning my suction catheter so that it's not leaving everything in my tubing. Because if you leave it in there, it's going to get hard and it's not going to work anymore. You'll have to replace the tubing. We're going to reposition the patient, sit him a little bit higher. Okay, we are done now. So I'm going to put him back on what he was on before. So he was on room air. If he was on nasal cannula, I would reapply the nasal cannula. If we're going to need to do this again, I would recommend leaving the nasal trumpet in. If not, then I would remove it. So if the patient may need suctioning again and maybe there's an order that says PRN, then we could leave it in, because it's going to be able to make it easier for this person to be suctioned. Okay. Discard of your equipment, clean up your mess, thank the patient. Thank you, Mr. Smith, for everything. Hope you feel better. Please let me know if there's anything else I can do for you. I'm going to go ahead and give you your call light. And then once I'm done with everything, I have to document everything and clean up my mess. Thank you and have a great day.